Well, hello, hello, hello. We are live on Turning Point with Patrice Williams. We have a special and wonderful guest today. I've been thinking about her. I was just telling her that I've been thinking about her for the when we first spoke, and we were talking about thinking about Solano Heals. I was thinking about it, talking to her, and then for the last few hours, thinking about her, prepping for the show, and I can't wait to introduce you to her. She's just brilliant. Her name is Dr. Shandi Fuller, and I'm going to bring her live now. Hello.
Hi.
Where's Doctor in your? I'm looking. Where's Doctor? You didn't.
Oh, sorry. I missed that part.
Okay, it's not like we have a whole lot of Black doctors, ma'am. We need you to put that handle on your name.
Next time.
Well, I tell you, it is an honor and a privilege to have you on the show. And I just wanted I pulled up your bio on LinkedIn, and I wanted to give the audience a little bit about you. Is that okay?
Oh yeah, sure.
So I'm just impressed looking at your background. You got your start, I believe, as a pediatrician for 9 years in Fairfield. Then you were a supervising physician, and then you were with the California Children's Services Medical as a director. And I'm going to read a little bit of what you wrote as your position as the deputy health officer in Solano County. And it was wonderful because you told us what a deputy health officer is and what they do. So you said a deputy health officer advocates and administers equitable care so that all children and families live to their greatest potential. Innovative in developing unique solutions targeted precise needs to each target population. Attentive in hearing all viewpoints and working closely with employees and community members to deliver solutions based on communication and cooperation. Whoa. Okay, we have the doctor on the line that wants families to live for their greatest potential.
Yes, definitely. That's the goal.
Oh, I said it and then I just got quiet because I just wanted to land for people because that's powerful talk. So I want you to tell us about Solano Hills. What is it and why does it exist?
Yeah, definitely. So first, Solano Hills stands for Health Equity for African American and Black Lives. And this group was implemented just about a little over 4 years now ago. And it was implemented because we have a real problem, a real issue, and that is that Black infants are dying at twice the rate of white infants. And this is true in the country, and it's true in Solano County. And so we actually applied for this community group to be started through City Match. And when City Match saw our data and saw, our drive and, our initiative to start something, it was a competitive application. We were actually chosen out of a lot of different other counties to participate in this. And so what we're doing is we're trying to decrease that. We're trying to eliminate the health disparity, and not only with Black infants, but we also know that Black mothers are dying at higher rates in childbirth. And in Solano County, we can't really measure the maternal rate because our population is small. So what we look at is like our near misses. So those are the instances that women almost died in childbirth. Like either their heart stopped and they were revived, or they lost a lot of blood, or something happened that if an intervention hadn't happened, then more than likely they would have died. And so when we look at those numbers in Solano County, it's still twice Black women have twice as many near misses in childbirth as white women. And so we know that that shouldn't be the case, and that in order to address it, you have to really look at the root cause of that. And the root cause, it all goes back to equity and our structural racism that we're seeing play out, in real life. And so we've, are having strategies to address those structural racism and those inequities so that we can make a difference.
Right. Are you hearing, or is there a way to capture when a Black mother dies in childbirth, but the partner reports in and says, my partner would not have died if this had happened. Are you able to capture that? And I only mention it because I remember a year and a half ago seeing a video of a gentleman that had lost his wife. And so he was the carrier of that information and that news, and it was so impactful.
Yes. And so, yeah, we're doing like focus groups and surveys, and there's been a real push. The good thing about all of this is that I think people are now recognizing that this is an issue. And so, like, the whole state of California is really getting initiatives to get that voice, to hear not just from the women, but also from the partners. And throughout the country, there's been, organizations and effort to try to get that information. Because not only do we hear that, but we also hear from the partners and from the birthing woman that we're not being heard. We're trying to tell our providers or our medical staff, or the people that are supposed to be helping us, we're trying to tell them, what our concerns are, but we just don't feel like we're being heard. So we definitely want to amplify those voices and get that data back. And so that's one of the ways is through the surveys and focus groups and things like that.
Okay. And now Solano Heals has been in existence for, is it 2 years?
No, we've been in existence for about 4 years now, a little over 4 years. And it really started as a community push. When we started, we had, when we were meeting in person, of course, we had community meetings down at the JFK Library in Vallejo. And the strategies that we developed came from the community. We had multiple meetings and different activities to really bring out what the community thought was the biggest need in different areas. And so we really, even though we've grown, and we still keep that community base going. And we just partner also though with other agencies like the county and other like medical agencies, Kaiser and La Clinica, Toro University. So quite a few.
Yeah, I remember seeing where Toro University with Devon was doing some equity work around is it called maternal deaths? Or I think I might be getting the title wrong, but there we are. It is really bothering me. The doctor is not listed on your title.
Yes, see, you changed it.
We're not playing with you.
Thank you.
It really was.
Thank you for that.
Here's what are the high points with Solano Heals and the low points? Like, what are your great successes where you're like, we've made a difference here? And where are those gaps where you're like, We missed it. We need something else here to fill that gap, to make a difference.
Yeah. So I think, like, especially the last 2 years, we really got momentum. And one of our biggest high points is that we were able to help Kaiser develop an exclusively Black centering pregnancy group. And so, for those who don't know what centering pregnancy is a model of giving prenatal care in which you meet in groups. And so it fosters like relationships between women because you're all around the same gestational age. And there's a lot of community and there's a lot of feeling empowered, because you're taking each other's blood pressure, you're learning about different topics. And we saw that they had good outcomes. Like in general, centering pregnancy groups have good outcomes. And so we wanted to see what that would look like if it was centered on Black women, having a safe space for Black women to get that care, and be heard and valued and all of that. And so ECSF had one just about a year before we developed ours. And so we were able to help Kaiser get that off the ground. And they had their first group about a year ago complete, or just under a year ago now, completed their first group. And so we were very happy, that we were able to help them with that. We also have been doing trainings for medical providers. And I think that we saw a great need because the conversations just weren't being had in the medical arena. So Devon Lee was the one who helped us create some of those trainings. And we were able to train Kaiser staff at OBGYN, our own family health service clinics. We were able to train, and even some dental agencies and folks like that. So we're happy that we got that going. And it's not just a one training. It is, you have to keep the conversation going. So it's multiple trainings. And so we're hopeful that at least that will start with opening the door to equity in those areas. And then lastly, we have our website. So we're really happy that we got that going. And then on our website, one of the things that we really heard back from was that mental health was a need, and to normalize mental health in the Black community and give resources and things like that. So on our website, we're developing a mental health toolkit. And soon you'll be able to go on there and see stories from women who have had challenges, with their mental health, and see how they were able to address it and overcome it, and other resources. And you can go there now. There are some resources on there right now. I think it's down there at the bottom for you to take a look at. So, but we're really happy with that. Some of the things that we really want to work on is, again, continuing that community-based group, and getting the community voices and actually having community champions and community liaisons. Because as things change, which they always do, we want to be on top of it with our strategies, and we want to not miss the mark, with what the real needs are right here in Solano County. So we're looking for community champions to get on board, to come to our meetings. We have a community meeting every other month, and we're doing that virtually right now. As soon as it's safe to be in person, we'll go back to being in person. But we really would like to, sorry, my dogs, we really would like to to have that voice, yeah, and to stay with the community.
It's the best thing about doing virtual and being at our house. Like, it really personalizes the experience. you know.
Yes, yeah. I'm like, they're my coworkers. So at some point, someone knocked on the door and then it's over with.
So, so, like, yeah, we all home. What do you want?
Yeah.
So what I've been doing is showing everyone the Solano Heals website. I am really impressed by this website. So not only you gave us how to get to upcoming meetings and events. So I clicked on that, and that's the screen we can see. But also these community resources are here, and they are very comprehensive. This is pretty amazing. And would the call to action be if you are a woman, and I don't know if it's just Black women or just women of color or women, period, that are wanting to have a baby, want to be healthy, or pregnant, or just have a baby, or just had a baby? Is that who would tap into these resources?
So the resources, we are very intentional that our focus is the Black woman and Black family. And you don't have to necessarily be pregnant or even have a baby, because really it starts before you get pregnant, and preconception care is something that's really needed. So even if you're even thinking of getting pregnant, these resources are for you. And again, it's not just about the Black woman, but also the family. So that could include her partners, so children, grandparents, all of that is what we take in consideration when we put these resources on our website.
You know, I've never even thought about preconception care. That's pretty amazing. And
Yeah.
what and hopefully I perceived this right. I went to I believe it was either a Black infant health meeting or Solano Heals meeting. And if I remember right, not only do you support partners, but you are LGBTQ friendly.
Oh, yes.
And I was like, that's what I'm talking about. You are
Yeah.
really completely grabbing hold of our community and meeting us where we are.
Yes, yes, we're definitely inclusive. And that's why I say, single woman, you and your partner, whoever that may be, because it takes all of us, right, to be able to make a change, and it affects all of us. So even though, our initial objective was with the Black infants, we saw very early on that it just doesn't stop there. It's the wholeness.
Mm-hmm.
Mm-hmm.
Well, so we are having a little bit of a technical challenge with our chat, but I'm going to try to fix it while we're talking. So for you all watching, if there's a little blip in the transmission, that is just me. That's me mucking it up. Just hold there with us for just a minute, okay? Let me try it because I don't want to miss questions that are out there for you.
Okay, no problem.
Okay.
I see someone said they love the dogs. Well, thank you very much.
Let's see. Okay, so you can see the chat.
Yeah, I can see.
You
I can
can?
see a couple. A couple. Yeah.
Oh my goodness, I can't see it. Okay, so we're gonna make you the co-host.
Yeah, I can see. I can't scroll, but I can see, like, there's a comment that says preconception health is really talked about, and that's very important.
Okay, who said that? We're
Lisa
making.
Jones Clinton. Yeah.
Okay, great. And another comment too.
Also from Lisa Jones Clinton, mental health toolkit is a great resource, and that Centering Pregnancy group is a great support for women.
Okay, you did a wonderful job, ma'am. Not only a great doctor.
Hey, versatile, right?
Absolutely. So we talked about Black infant health, and I was telling you that there's a question out there as to, does it still exist? And that organization, led by someone that I am pretty crazy about, Miss Lyons. Does it still exist?
Yeah, yes, it does. And so what happened was the model changed. So the way that the care is given has changed. So it went from a group approach where women would come in groups and get their education information that way to more of a one-on-one approach where someone actually comes to the home and you're assigned a health educator and works more one-on-one. But yes, it's part of the Healthy Families of America model,
Yes.
and so it's still up and running.
Well, I tell you, I'm on your team page because I know I saw a picture of Sakari there. It sounds like she's on the Solano Heals.org team. But you
Yes.
have a powerhouse here. Danita Taylor does amazing community outreach, and Lakeithia Lake Pasquella, I hope I'm saying her last name right. She is quite phenomenal. So I know Loretta and Angelique have got to be pretty amazing too.
Yes, yes. And actually, not Dr. yet, but Sakari Lyons was one of the founding members, and she used to be the co-facilitator before I came on board. So, and Lakeithia as well. Hmm.
Oh my goodness. I tell you, we're just
Yeah.
a very small community. Um, and no, I still can't see our chat. So let's see. Um, what I will do after the transmission is I will give the website address, but I'm going to just do it right now as well. www.solanoheals with an S.org. That is it's a wonderful wealth of information. Um, and not only can you get all these community resources, but also you can access their community calendar. Right now it's still 2020, but I'm sure that they're going to be uploading 2021 soon. And this is a way for the community to to get involved, But, before you left, Dr. Fuller, I wanted to talk a little bit about equity. You were telling me that there were strategies to um, to uh, to dealing with equity in care. So I want to know a little bit about that.
Yeah. So when we talk about this, um, it's really important to look at it from an equity framework and to look at like what you can do now that is helpful, and then what you can do that's helpful, but you may not see the results until later on. And we refer to like upstream, downstream strategies. And so those were the things like the training. So the race equity training was one strategy. And that is something that we approach for the medical field, so that because we know that racism exists in medicine, you know, it does. And we know that people hold bias, and that we see that in the gaps that we see in our health disparities. But we also know that it's not really talked about, and that there's some lacking in education up until recent years with training doctors and nurses and medical assistants and the whole bit on equity. And so one of our strategies is to start doing that and training people on equity, and teaching people about racism and how that affects all of us, and especially people of color, how that's having a really detrimental effect on our health. And so we've been developing, some trainings around that, and also messaging that it's not just a one and done training, that it's taking us, years, centuries to get to where we are. And it's going to take multiple conversations and a lot of unteaching to get to where we need to be. And then the other two strategies was the centering pregnancy group, and that's more of something that you're going to see the effects of more in the present, because those groups of women, once they go through that centering pregnancy prenatal care, then we're hoping that they will have healthier pregnancies, healthier babies, and we'll be able to see that right away. And then lastly is we know that racism has a profound effect on our mental state being, and that it causes stress. And you may have heard of like toxic stress and how that all affects our bodies, and that we need to do a better job with, just in general with our mental health, and normalizing it, that it's okay if you want to see a therapist, it's okay however you want to give yourself self-care and to process that stress. But I think what the main thing is that we need to always keep in mind where that stress is coming from. And so even though we have mental health strategies and centering pregnancy strategies, we can't forget that racism exists. And if we don't ever talk about it or address it, then it's always going to be an ongoing thing. So we're very intentional whenever we have our meetings to talk about it, and to now we're looking at other strategies of how to, dismantle racism and how to be anti-racist.
I need you to come back next because we're putting together a panel surrounding conversations surrounding racism and how to dismantle it. And mental health is huge, and how it impacts us, how it impacts our bodies, how it's a real thing. It's a real thing. I remember seeing a few months ago. Well, okay, so there's a few things that I've noticed that I haven't that impacts me. One is anytime that there is a George Floyd, type of like full on, we can visually see Black people being harmed. So mentally, I kind of go like mentally down, like I'm in the bed, I'm depressed, um, I'm sad, I have a 18-year-old son at home. I'm doing way too much, like fussing at him. I'm like, I do to be safe. I'm giving him, be careful, speech. Um, so it's all that going on. And I tell you, I went through a mental thing a few months ago too, a mental kind of going down mentally, where I heard that Black men were being hung in the country. And just to imagine that in 2020, Black people are being hung. I'm getting emotional just talking about it now. Like, that's nuts. I literally couldn't talk for days. I couldn't move for days because it's not something that I ever thought would be something that's happening in our generation. It's just such an assault of hatred to take somebody's body and do that. So I don't know. I mean, it's real. It's real. Like I literally was like, I need some resources. I need somebody to talk to.
Yes, yes. And I think that's like the first step, to realize that, and that it's okay to say this is too much. We have a pandemic, then we're seeing George Floyd and all of the many Black people be killed in front of us. And then we have our everyday stress, and it's a lot. And I think a lot of us felt that, just the heaviness of it. And then we're expected to come to work and act like everything's okay and that this doesn't affect us, and it does. And we are seeing, how it's affecting us. So I think that you're absolutely right. And I think that, we definitely it's okay to say, I need help with this to get through this, At the same coin, you know, it's not okay that we're seeing, you know, Black bodies being killed, and that we're seeing Black bodies be killed, but also that there's no, you know, answer for it, and there's no like, you know, retribution for it. And that too is another layer of just heaviness and just, you know, a sense of fear, like you were talking about with your son, and just, you know, every day, you know, like there's a risk. But that's why, you know, mental health and really healing yourself, and we need to heal our communities, and we need to heal our systems. But first, we need to have the difficult conversations, and then we can get to a place of where we're healing, you know, not just being resilient, but that we heal from all that's happened to us.
Okay. Does that mean you're coming back next year?
I'll be back.
Yay. Okay, I'm excited. I am so excited. Well, this has been amazing. I have kept you. I told you 20 minutes. I had a feeling it was going to go longer, but
20 minutes too short. Right?
it's not long enough. It's not long enough. And if there's a comment that's grabbing you, you let me know. And if not, we'll just kind of move to our final, which is, you know, a call to action for the community. How do they get involved with these different initiatives that you're working on? Anything grabbing you?
I can't really scroll, so I'm not sure if I can see all of them. But there's one comment in here from Empower Solano. Black women in particular need to be relentless in receiving quality health care. And I will second that. Can I just say one thing about that?
Yeah.
So one of the other reasons why we really wanted to do a training for healthcare providers is because even though advocacy, like we all should be advocates of our bodies and everything, but it can't stop with that. You know, there has to be some responsibility and accountability with the healthcare profession that say that, you know, that we feel safe when we go and see our medical providers. I had a child come in, well, it wasn't a child, I had a newborn come in with their parents, and the father is African American and had been in the military. And this was their first visit with me. And when they came in, the first thing he said was, "Are you Dr. Fuller?" And I was like, "Yes." And he goes, "Great, I feel safe now." And that just, it still gives me chills and kind of breaks my heart in a way too, because you should feel safe going to, regardless of who walks in the door, you should be able to feel safe. And that's not the case. And that's not what we're seeing. And so, yes, you know, advocate for yourself, but we should get to a place where we don't have to push and fight and just to get the same level of healthcare as our white counterparts, and that we should all feel safe when we go to the doctor, because we know we're going to be heard, and we know we're going to be valued and seen and given the same level of care.
You know, thank you for highlighting that. Advocating for ourselves, and B, you being a doctor and acknowledging that, you know, there are times where we feel dismissed.
Mm-hmm.
Because that is absolutely accurate. And that advocacy is such, and being comfortable advocating is so big, because I know there's plenty times I go to the doctor and I'm like, okay, let me give you everything that I think, you know, is going on. There's a bump on my neck. This place right here is a little browner. Da da da. Like, you know, and I love it when I have those doctors that are like, you know what? Give it to me all. We're gonna just work through, and then you have something that's like, if you don't go sit down, I'm like, I'm gonna worry about these things. I need to know about all of these changes I see in my body, and I need to be able to. But there's absolutely times that I've been dismissed. I just won't let them dismiss me.
Right.
You don't have a strong enough voice to be like, oh no,
Right.
we're together, so we figure it out. But that's a real thing, you know.
Yeah.
So I love this. I love this dialogue. This dialogue got so much deeper than we're talking about racism. We're talking about inequity. We are talking about all types of stuff. So yeah, I'm gonna have you for sure come on next in 2020. I think we're setting this up for either January or February, where we're just gonna tear apart the edges of racism.
That
And
sounds. I love that. Yeah, I love that.
mhm, mhm. All right. Well, thank you. Oh, wait. You were going to do one more thing. You were going to
Oh
give
yeah.
us a call to action. So what?
Yes. So
Mm-hmm.
the call to action is that please come to our Solano Heals community meeting. The calendar for those meetings is on our website, and right now we are hosting them on Zoom. But we really would love to have some community champions that can take this work and just really run with it, and actually have a position in our advisory board as a champion for Heals. So if you like our strategies, you're on board with what we're trying to do, and really want to see a change in your own community, then please, the first step, just come to one of our meetings and we'll get you right in there to be a champion.
Your meetings are wonderful. They're
Thank
absolutely
you.
okay. So
Thank
I
you.
am going to put you in a virtual waiting room and say goodbye to everyone. But don't you go away, okay?
Okay.
Well, was that a lot of fun? I knew that I see all the lives. I hopefully I'll see the chats later. But as I said, Dr. Shandi Fuller, and nope, that's not me. Her caption is still up, but she was absolutely wonderful. I feel inspired, and I know you did as well. Tomorrow is going to be a special show. We're going to have we're going to have Brother Ray Cardamarchant. Okay, I have that wrong. He's going to correct me tomorrow on how to say his name. He is doing this he's with the Matt Garcia Foundation in Fairfield, and he is going to tell us about a homelessness youth initiative in Solano County that is citywide. He is going to be with us tomorrow, and I want you all to come back. But in the meantime, if you connected with this program, if you love what we were saying, I want you to tag organizations, tag groups, tags friends. We are looking to grow and to touch everyone in Solano County with this important community information. Also, I am Patrice is where you can reach us on all of our platforms, and we are going to podcast. You'll be able to find us on all your favorite podcasts as well, starting next week. But with that, my name is Patrice Williams, and this has been Turning Point.